The automatic door slid open with a soft hiss, letting the chill of the night and the sharp scent of antiseptic layered faintly with lavender. A woman hurried in, clutching a trembling Pomeranian wrapped in a blue baby blanket, her eyes red and swollen, lips quivering as if a word might break her open. Behind her, a man paced tightly, arms crossed, jaw clenched. The receptionist didn't ask questions, just buzzed them through. This wasn't a regular vet clinic. This was the kind of place you only learn about when the regular clinic said, asterisk, you need to go somewhere else, now. Asterisk a $500 a night animal ICU, where dogs and cats and ferrets and turtles fought for their lives under the glow of softly tinted lights and a constant, rhythmic beep of machines that sounded suspiciously like second chances. Everything gleamed chrome, glass, touchscreens. But beneath the tech and tailored design, this place radiated something older, love with a spine. Every corner was built for desperation. Every square foot engineered for hope. In a glass-walled suite, a senior golden retriever named Maximus lay inside a hyperbaric oxygen chamber, his chest rising and falling steadily. A wet towel lay gently over his hips. A tech whispered updates into a headset. On a small whiteboard outside the room, someone had doodled a cartoon dog holding a sword. Maximus the Brave. Further down the hallway, past the coffee station that dispensed calming teas and organic broth for both humans and pets, a nurse gently lifted a sedated Maine Coon onto a gurney, its limbs swaddled like an infant. Soft landing. Apollo, she murmured. Let's find out what that heart murmur's been hiding. There were 4 lines, ultrasound carts, and portable EKG machines. Every few feet, a vet moved like a ghost in Crocs, murmuring patient stats, flipping tablets, recalibrating meds. Their scrubs were spotless, but their eyes held the weight of long nights and the quiet ache of maybes. In one corner room, a French bulldog named Lulu was getting post-op laser therapy for spinal surgery. She wore a tiny hoodie that read Wigglebutts Club, and the room was dim with a soft blue light. A therapist, kneeling beside her, whispered praise into her ear as red beams pulsed slowly over her lower back. A sign on the door read, Quiet, please, healing in progress. In another suite, a parrot named Rico kept singing Despacito, even while being tube-fed. No one could figure out how he was still vocal, but he was. A nurse chuckled and said, That bird's got more lives than TikTok trends. The tech room was the hive, the control center. Monitors blinked and updated in real time. Charts glowed. Blood work populated in seconds. A veterinary intensivist, not yet 30, stared at a screen so intensely her colleague nudged her. Did you eat today? She blinked. I think yesterday. In the corner of the waiting room, a boy sat cross-legged beside a husky who had collapsed just hours earlier. He was drawing on a sketch pad, his dog, flying through clouds. The nurse walked over and crouched beside him. That's pretty amazing, she said. He nodded. She's always wanted to fly. A woman arrived with a ferret tucked inside her jacket, tears already falling before the doors closed behind her. She didn't speak. She just held it out with both hands like an offering. The intake nurse caught the urgency in her eyes and disappeared with it down the corridor into the hum of triage. Some owners brought bedsheets from home. Some brought playlists. One family brought an entire suitcase of their dog's favorite toys. Another brought a priest. At 3 a.m., in a small room lit by nothing but a salt lamp and moonlight through blinds, a vet knelt beside a couple and their 17-year-old cat, letting them hold her paw until the seizure passed. Let's not make any decisions in fear, the vet whispered. We got options. And then there were miracles. Quiet ones, undocumented by anything except the staff's memories and a few thank you cards thumbtacked in the break room. A rabbit with sepsis who walked again. A collapsed dachshund who, after 36 hours in a sling, wagged his tail. A kitten born in a shoebox that now pawed at nurses' ID badges like it had been hired. No one really talked about the cost. Not here. Not while the machine was still beeping. Not while the breath was still there. It would come up later. $500 a night for ICU, more for scans, for surgeries, for blood transfusions flown in from other states, for that cutting-edge anti-venom. The kind of bill that made you inhale sharply, but not as sharply as you did when the doctor said, He's stable. He's going to make it. And if you asked those who had waited all night in that sterile, softly lit room, clutching leashes or blankets or a single tuft of fur, if it was worth it, they would look at you with something raw and wild in their eyes, as if you had just questioned whether love deserved a second chance.